The U.S. Health Department has announced plans to modernize the organ procurement and transplantation network, which is responsible for organ transplants in the U.S. and has a waitlist of over 100,000 people. The network has been managed by the private nonprofit United Network of Organ Services since 1986, but has faced criticism for its high kidney discard rate and outdated technology. The U.S. organ transplant system is set to undergo a major overhaul, with plans announced to break up the monopoly power of the nonprofit organization that has run it for the past 37 years. Federal health officials aim to create a competitive environment by inviting other organizations to bid for separate contracts, hoping to improve the inadequate system that leaves nearly 104,000 people on waiting lists for organs, with 22 people dying each day awaiting transplants. The plan proposes changes to how the network is structured, installing a strong independent board of directors, creating a public dashboard for data transparency, and amending the 1984 National Organ Transplant Act. The Biden administration has committed $67 million to the proposed modernization of the transplant network. The federal health officials are aiming to break up the monopoly power of the nonprofit organization that has run it for the past 37 years. The United Network for Organ Sharing, UNOS, oversees the U.S. transplant system, which includes about 250 hospitals that perform transplants. However, the system has left nearly 104,000 people on waiting lists for organs, with 22 people dying each day awaiting transplants. The discard rate for procured kidneys in the U.S. was 21.3% in 2020, and for countries such as France and the United Kingdom report much lower discard rates for kidneys, ranging from 8% to 12%. The Senate Finance Committee has found 70 deaths and 249 diseases over a 7-year period due to mistakes in the screening of transplanted organs. According to data from the Organ Procurement and Transplantation Network, there are currently thousands of men, women, and children waiting for organ transplants in the United States. In fact, every 10 minutes another person is added to the waiting list. Tragically, 17 people die each day while waiting for a transplant. The need for organs is great, as certain organs are in higher demand than others. But every donor has the potential to save up to 8 lives and enhance over 75 more, making organ donation a powerful way to make a difference. In 2022, over 42,000 transplants were performed, giving hope and renewed life to those who received them. By becoming an organ donor, you too can make a life-changing impact and potentially save lives. The United Network for Organ Sharing, UNOS, is receiving criticism for the mismanagement of donated organs. The agency is responsible for overseeing organ donation and transplants in the U.S., but several incidents have been reported, including the transfer of organs with the wrong blood type or those infected with cancer. The Senate Finance Committee uncovered several incidents that were previously undisclosed, leading to criticism from both Democrat and Republican senators. The current system has been described as outdated, and UNOS is 15 times more likely to lose or damage an organ in transit than airlines are to lose or damage luggage. A lack of tracking and outdated technology have been blamed for the inefficiencies. Despite a new policy implemented by UNOS to prioritize sicker patients over those who live closer to transplant centers, nearly 100,000 patients are still waiting for kidneys, and 5,000 patients a year are dying on the waitlist. 1 in 4 potential donor kidneys is wasted, partly due to transportation issues. Organ donations have been arriving late, damaged or diseased, leading to criticism and calls for another entity to oversee the organ transplant system. The National Kidney Foundation is calling for improvements to the organ donation and transplant system in the United States, citing concerns about the current system's performance and lack of accountability. The prevalence of chronic kidney disease is expected to increase dramatically in the coming years, creating a public health emergency that requires immediate attention. According to data from the Organ Procurement and Transplantation Network, every 10 minutes another person is added to the waiting list, and 17 people die each day while waiting for a transplant. In conclusion, the proposed modernization of the transplant network is an important step towards improving the current organ transplant system in the United States. By addressing issues such as outdated technology and high discard rates for procured organs, this plan has the potential to reduce waiting times and save more lives. Despite the challenges faced by the current system, organ donation remains a powerful way to make a difference and potentially save lives. Thanks for watching this video. Please like, share and subscribe our channel for more such videos.